tell us how valve disease is diagnosed, Dr. Quesada?
So there's multiple ways of diagnosing valve disease. The most important thing is history. Patients have a history of diseases that are inflammatory when they are children, like rheumatic heart disease. So when they get adult, they're potentially going to have valve disease. So history is very important. Physical examination, obviously, because you heard murmurs and all sort of things. And then we have diagnostic tests. But remember that the diagnosis is made with the history and the physical examination, and we corroborate our findings by doing tests, imaging. Ultrasound of the heart is the most important tool in the clinics to diagnose more specifically the damage or the extension of the valvular heart disease. And then we have other modalities like CT scan, and MRI.
And let's look at some of those diagnostic tests right now, doctor, so we can show our viewers and you can talk about each one. Let me know if these are one or do you use all of them? Echocardiography, ECG, chest x-ray, cardiac MRI, exercise test or stress test, cardiac catheterization. Dr. Sanabria, are these that you use all of them, or is there one specific one that it's your go-to?
We mainly use most of these ones. The most common ones that we can use in our office is mainly the ECG or electrocardiogram and the echocardiogram. Those are usually the ones that we use in our office. The stress test is also a very helpful tool when we are not sure how severe the valve disease is, and we can put the patients on the treadmill and see how affected the patients are, the symptoms, if the symptoms are triggered by exercise. And then in the hospital, we usually use the cardiac catheterization or cardiac MRI, cardiac CT to plan the treatment. So those are mainly the tools that we use for diagnosis.